Iris Rose has much to live for. She loves her independence and her family. But one day, she found herself ready to give it all up.
My whole life changed. I was to the point where I wouldn't have cared if I would have died.
A lifetime of smoking caught up with Iris. She was diagnosed with chronic obstructive pulmonary disease, COPD. Iris was in and out of the hospital and on oxygen 24 hours a day.
I can't explain the feeling. It's a horrible, horrible feeling not to be able to get your breath. That's just awful.
In addition to robbing her of her ability to breathe normally, Iris could no longer live on her own.
There was no way that I could stay by myself. I was too sick and too weak. I could not even, like at night when I go to bed, I could not even lift my legs to put them up on the bed myself. My daughter-in-law had to do it for me.
10 months later, Iris was smoke-free and back to her independent self.
It's as different as day and night. I am a completely different person.
The Blessing Hospital Pulmonary Health and Rehabilitation Program changed Iris's life. The customized, supervised exercise program helps people with moderate COPD regain their quality of life.
At the end of the program, the majority of the patients, they do feel much better than when they were going into the program, and their exercise capacity, they feel that it's improved.
Dr. Reddy says completing the program can also reduce COPD-related readmissions to the hospital. To maintain the gain they experience, patients are strongly encouraged to continue their exercise routine after graduating from the Blessing Hospital Pulmonary Health and Rehabilitation Program. Iris did. She exercises every day of the week.
I want to live. So, do I like doing the exercise? Answer is no. I'm lazy sometimes, and I don't like to do it. But I know I have to do it if I want to breathe.
Dr. Reddy encourages every patient who's a candidate for the program to look past their fear to see the benefit of the program.
Some patients are psychologically thinking, I cannot do that. I cannot do that much of exercise because I have lung disease. But at a supervised setting, when they find out they can do some of the exercises, and especially the walking that they thought they were not able to do, that gives them a lot of psychological advantage.
Iris Rose is living, breathing proof of the benefits of the Blessing Hospital Pulmonary Health and Rehabilitation Program.
If you want to breathe, if you want to live to see your great-grandkids or your grandkids grow up and to be able to love them and spoil them rotten, then you do the program.